Hello, dear doctors. Today we'll discuss how to write patient note for case on page number 70 from first aid, which is about 25 years old person with dry cough. For general instructions on patient note writing, please check out my first video on chest pain. And as always, I advise you guys to start with your differentials because those are most important part of your patient note. And first differential for this case is atypical pneumonia. Second one will write post-infectious cough. Which is persistent cough after upper respiratory infection due to irritation of respiratory tract. And third one is GRD. And we write down couple diagnostic studies that come to our mind immediately. For cough cases, you have to write both projections because AP does not catch some posterior segments, and then we go to our history. Dry cough for 2 weeks, no progression, no aggravating or alleviating factors. Also, patient complain of fatigue, let's say diffuse muscle aching. And we have information about some upper respiratory symptoms 3 weeks ago in this patient. And the rest of history we create based on first differential of atypical pneumonia. We can make signs positive or negative as we like. It's up to you. And we have to be focused on questions for this very case. You have to ask about coughing blood in all cases, in all cough cases, as well as chest pain and shortness of breath. And also fever, rash, night sweats, change in voice, or LAD, because all those signs can be present in atypical pneumonia, and if you suspect it, you have to ask. And some general questions on review of systems. Then we go to medications. This is abbreviation for prescribed and over-the-counter medications. No allergies. And patient, let's say he tells us that he has heartburns managed with diet. Okay. No surgeries, traumas, or hospitalizations. It's not a case of chronic cough because it would be chronic if it would last for 1 month, but we still better ask about PPD. And then we go to sexual and social history. And now we can copy this for all our differentials. Because it's the same for all of them. And now we start to fill our physical. Let's say this patient does not have any fever or any increased respiratory rate. Cardiovascular can be restricted to just auscultation. No murmurs, rubs, and gallops. But lung exam have to be broad. Everything: auscultation, percussion, vocal tactile fremitus, auscultation and percussion bilaterally, vocal tactile fremitus intact, no wheezing, raise or bronchi. And also we have to check extremities for clubbing. And now we start to copy and paste for history and physical in support of our differentials. A typical pneumonia cough usually does not have any aggravating or alleviating factors, as well as post-infectious cough. Okay, fatigue often accompanies a typical pneumonia. Diffuse muscle aching. What else? Upper respiratory infection symptoms. Go in both lines, and also young age. So a typical pneumonia is usually common in young age, so it also will go in support. And now we can feel our physical exam. So all those lung exam findings can be impaired in patients with atypical pneumonia. They can have wheezing, rales, bronchi. That's why we can't put those findings in support for physical for typical pneumonia, but what we can put is no clubbing, because it usually accompanies chronic conditions. So if your patient has fever, you can put that temperature is his temperature, or if he has increased respiratory rate, you also can add the line here, but not in this case. Here we can put no LAD, febrile. Those patients usually are febrile and they don't have any findings on chest exam. You can copy and paste if you like. And in support for GRD, we also can add history of heartburns. No shortness of breath, no fever, no chest pain, because those patients usually does not have those signs and those symptoms. And same from post-infectious cough, we'll go here. Sorry. And we add other studies for this case. Ramstein and culture, immunoglobulin M, and let's say also urine. You can see those studies in your first aid. That's it for a case of atypical pneumonia. My next patient note will be about some musculoskeletal problem.